Our final speaker for this session is Dr. Michael Parker. Dr. Parker received a Bachelor of Arts degree in biology from Kenyon College in Gambier, Ohio, Doctorate of Medicine from the Ohio State University College of Medicine in Columbus. Since 1993, Dr. Parker has been in private practice at the Northeast OB-GYN Incorporated, a NFP-only OB-GYN practice in Gahanna, Ohio. In addition, he has served as the chairman, Clinical Performance Improvement Team, and as the chairman of the OB-GYN department at the Grant Medical Center in Columbus, Ohio. He is certified by the American Board of Obstetrics and Gynecology and is certified as an NFP medical consultant. He serves as a medical director for the Kinder Women's Care Center and as president of the John Paul II Guild of the Catholic Medical Association in Columbus. Please welcome Dr. Michael Parker. Can you go back to Columbus?
I like to try. Thank you. I'm going to thank Steve for introducing me, and I'm also going to blame him and several others for me being up here. I was not always of the mind that I am right now. I started out in private practice as just a regular OB-GYN, prescribing contraception, and at one point I was doing probably more sterilizations in the city of Columbus than any other OB-GYN because I was taking care of the local clinic service at our teaching hospital. And so I was not always of this mind. But Steve Koob influenced me in many ways through phone calls and contacts and many others, but I really have to blame Sister Renee. And I'm really going to hold her to task for me being here because when I went to the Pope Paul VI Institute in 1999, I had no intention of becoming an NFP-only obstetrician gynecologist, none at all. And in fact, I was only there to audit so I could learn because I had more patients using natural family planning. And Sister gave her wonderful talk on Humanae Vitae. And the Holy Spirit came from her mouth and brushed down the back of this huge auditorium and smacked me in the head. I was standing in the back. I was the guy with his arms crossed. I can't believe this stuff is no good. Called my wife that night and told her that things were going to change. And they have changed. And they have changed much, much, much for the better. I am very, very blessed. John Bruchalski was also very influential. He came and spoke at a very, when I was a very nascent person to the Natural Family Planning Program, at a CMA event that we had in Columbus, Ohio, and I got to hear his story, and it gave me inspiration and motivation to continue on with my plans. But I think eventually, you know, it's kind of like that game, 7 Degrees of Separation to Kevin Bacon. I think we're eventually going to play a game, 7 Degrees of Separation to either Thomas Hilgers or John Paul II. I'm not sure which one I want to choose yet before I create the game. So, what I'm going to talk to you about today, and this is a reprise of a talk that I gave in Rome at the 40th anniversary of Humanae Vitae for Dr. Hilgers and the national meeting of the American Academy of Fertility Care Practitioners, is what happened to my practice when I went natural family planning only. And I did this for several reasons. How do I go to the next one? How do I go to the next slide? There we go. Okay. Here's the timeline of what happened for me. In 1993, I joined the current practice that I'm in. I am the only NFP-only OB-GYN in central Ohio. We've recently had several NFP-only OB-GYNs come to the state of Ohio, one from Dr. Hilgers' fellowship, and there's, I believe, one more up in Toledo now who just made that conversion. But it wasn't until 1997 that I first heard the words Humanae Vitae. And granted, I'm a child of catechism of the 60s and 70s. And I'd never, ever heard these words. I didn't know what they meant. And I took Latin for a year or two. And just never heard of them. Somebody introduced me to it. And then I just ignored it, like most things I did at that time. Went on with my life. I thought life was going to be great living where I was. In 1999, though, I went to the EP1 in Omaha to learn about natural family planning because of a couple that I was working with infertility who refused to go past certain points within their treatment because of their Catholic beliefs and faith. And if you talk about a way that somebody can influence you in such a small way, this couple stood their ground with me when I recommended them to the IVF specialist. And they really put that spark in me to learn more about my Catholic faith and about what it meant to be a Catholic OBGYN. So they're the ones that got me out there to hear that very influential talk of Sister Renee and the Holy Spirit. I decided at that time that I was going to come back, and I stopped doing IUDs and I stopped doing sterilizations. My partners thought I was absolutely crazy and nuts, but and so did I. And my wife was really, she was ready to, I don't know what she was ready for, but she was confused and dazed, and I think many of you who will make a decision someday to follow your heart and follow your faith will find many people who want to come with you, but they share some of the same anxieties and fears that you've already overcome. So you have to be patient with them, and you have to pray for them. In 2001, I completed EP2. It took me a little bit longer because in between there we had the birth of our 5th child. And my wife said, there's no way you're leaving 4 weeks after I just had a baby. And I agreed with her, as I always do. And I took a year off and I went back and I finished. Even then, I was very reluctant to change. I came back and I was promoting natural family planning within my practice, specifically the Creighton Model Fertility Care System. The other problem I had is I only had one practitioner in the state of Ohio, and she lived in Tiffin, which, if anybody knows where that is, that's halfway between Columbus and Detroit. Okay, and so she would come down, God bless her, every other week or once a week, and she would work with my patients in the office and teach them the Creighton Model Fertility Care System. And the couple that got me into this program was our first success. And to make it even more influential, our first success was a Down syndrome baby. And I still see this girl because she goes to our school, and she's still the most important and the most precious success that we've ever had. Because it says to me, God can make things change through even those who have the least. They have the most. And I'll never forget an episode of Law & Order, if anybody ever watches that, where they talked about, I think it was an infanticide of a Down syndrome baby or something like that, and they were talking about made in his likeness and image of God. And one of the attorneys says, maybe that's the image of God, and this is what we've evolved into. They are simple and they have the ears of the angels, so they listen to them. In 2004, I believe it was at the anniversary conference for the Pope Paul VI Institute in Omaha, my wife finally caught up with me, and we made the decision at that time to go NFP only, and we changed our practice over completely. This was an interesting story also. I love to fill my talks with anecdotes. I went to confession for the last time about prescribing contraception, and our wonderful Dominican priest said to me, he says, have no fear, go talk to Dr. Parker. And I said, well, I am Dr. Parker. To which he said, I'm sorry, and in the confessional I said, you're forgiven. And I've been told by our bishop I cannot give him absolution. But he said his final words to me, he said, have no fear, you will be lifted up on angels' wings, and you will be held high above and given great graces. And I can't say that that's never been more true. In 2008, when I prepared this talk, we were then up to having 4 practitioners working almost exclusively with me, and a very busy surgical and medical nephro-technology program. I did have to do a lot of my training on my own, since there's nobody else who really believes in this process. Some of it was through shadowing Dr. Hilgers, but I have to give a great deal of credit to Dr. Mark Stegman out of Camp Hill, Pennsylvania. What was the struggle? This is what kept me back. What was going to happen to my patient volume? What would happen to revenue? What kind of patients would replace those that I lost? Am I absolutely crazy? In today's age where you have so many loans, you have so many this, that, we live well beyond our means, we have credit going out the wazoo, my wife and others thought I was absolutely crazy. My purpose of my talk is to inspire others who may be contemplating change, or know others who may be contemplating change to the way they practice medicine, and to show how change affected my practice for the better, the worse, or neutral. Our expectations going into this in 2004 would be that we would see a 50% decline in patient volume. This was based on what I talked to other physicians about, what I'd read, what other people were cautioning about, which meant I expected a 50% decline in charges and revenues. I also had to face the possibility of my partners not being supportive of this and changing to a new practice group. And I could use Mr. Van Dolen to come up and do this because I know nothing about running a practice then, and I didn't want to. That really scared me even more than changing the way I practice. And then what was the change to my professional standing? How would I be viewed among my peers within the community? I had trained at prestigious universities, and I had been chairman of our department for several years and held several teaching positions. When we look at the number of patients' visits, those are by the months down there going back as far as, I believe, 05, I can't remember, and through. We see a significant dip right about the time where I made a change in the way I practice medicine. But you can see it didn't take long for me to get back to where I was. In fact, we saw several spikes as things went on. People finally said, finally, we got somebody who believes how we believe and is going to listen to what we want and what we care about and how we do things. Charges and revenues also took a dip, but again, they came back very quickly. We had our most successful year last year in both charges and revenues in 2011. Not that this is overly important to me anymore, okay? But it's very important when you want to sustain a practice and you want to be able to come and give talks like this and you want to be able to mentor medical students and other people and to learn more about your techniques, you got to have some way to financially support you. Dr. Brochalski could probably tell you more about that than I can. But it was a dip initially, but you can see things evened out, and it was almost like there was no change at all after 6 months. There were changes to the way I practiced medicine. I went from being a more paternalistic to a more holistic approach, to where I thought I knew everything, to where I thought, I got to listen. I got to look at all the approaches. I got to listen to what the people are saying to me. I've got to start thinking outside of the box. The easiest thing for a regular OBGYN to do is to practice regular OBGYN because he's got a solution to everything. You have abnormal bleeding, you give him the birth control pill. You got mood swings, you give him the birth control pill. You don't want to get pregnant, you give him the birth control pill. Okay? Your wife's, your husband's angry at you, you give him the birth control pill, or you give it to him. But it's a very simple solution. You know, it's a very simple solution. They oftentimes don't have to think outside of the box, which led many people to come and see me. Because even with those changes, they weren't feeling good, and they had nothing better to offer them. And so when Sister talks about NAPRO technology really providing a better approach and a more holistic approach to health care, it truly, truly does. And I actually tell people that I think I am a better physician and more knowledgeable physician and more competent physician because I had to go back and relearn everything. And I had to find ways that were as good as, or if not better, than the common ways of the birth control pill to treat patients. We did start seeing more complex cases with multiple diagnoses. Again, I think it's because other people stopped listening to them, and they found somebody who would spend a little bit of time with them. And my wife and daughter, who has actually worked in my practice, think I'm absolutely nuts. But it has been more fulfilling, okay? Because you are actually helping these people not only on a physical level, but on a spiritual level and in a relationship level. We do see an increased number of visits for follow-up. These people do need a little bit more follow-up than just putting them on a birth control pill. We do see an increase in just the number of consultation times, people wanting to come in and talk about their problems, not necessarily wanting to have something fixed, but just want somebody to listen to them, or talking more closely to find out and dig deeper about what the problems are to see if we can find a solution to what's ailing them. The age of my patients changed a little bit, but not a lot. Over on the right-hand side, you can see the CPT codes for office visits, and I can't remember what these are, but what we see, this is for office outpatients that were new, okay? And the light blue numbers are the youngest patients, and the purple ones are the older ones, okay? So the purple ones might be 18 to 24, the red ones might be 24 to 40, the yellow might be 40, I can't remember. But what we see is that we see an increase in the number of visits No, this is for time, I'm sorry. Visits for time, with 99203 and 99204 and 99205 being the more lengthy time visits, okay? So we're spending more time with the patients. We're digging deeper into their complex issues and finding out what's wrong with them. Again, this is, I want to say this is the age of the patients too. Pardon me? Is it E&M still?
Yeah, you're in the visits.
Oh, recurrent visits. Okay, so you can see the number of recurring visits. Thank you for all you coders out there. If you're looking for a place to work, many of us can use coders. But I appreciate it. I should have looked these up beforehand. I thought I remembered what they were. But these are E&M visits, but you can see there's longer time spent in follow-up visits with the established patients. New office consultations, since we made the change relatively soon after I prepared this talk, we can see that we're spending more time in hour-long consultations, 40-minute consultations, and 30-minute consultations. Most of the consultations that I do now are for infertility, polycystic ovarian disease, and some type of other dysfunction. I'm going to move on quickly because I'm forgetting these and we're running out of time. The most common problems that I'm seeing now: ovarian dysfunction, ovulatory disorders, abnormal bleeding, polycystic ovarian disease. Thyroid dysfunction has become a big part of my practice. Infertility is huge. In fact, one of my biggest referral sources is the nurse at the reproductive endocrinologist office, because when they get frustrated and they can't go there anymore, they say, go see Dr. Parker. Endometriosis and its treatment has become a very big interest of mine, and I believe that I've had to expand my surgical skills because of this. And then issues of adrenal fatigue, which I think is highly overlooked by a number of physicians, is probably the #1 cause for chronic fatigue and depression among many of our patients that we see. I've had to learn how to use new medications, naltrexone being one of them, the safe uses of cortisol within practice, supplementation with DHEA, thyroid supplementation, adrenal supplements, and other mucus enhancers. My surgical practice has gone from being a destructive practice, where I was doing tubal ligations, hysterectomies, removing organs because of either endometriosis, pelvic adhesive disease, or other things, to more of a restorative practice, where we are now restoring them back to a state of health. We're doing microsurgery to fix fallopian tubes. We're doing conservative surgery for endometriosis to maintain fertility, and we're helping patients with pain. As I said, I had to also learn new procedures. These are not necessarily new procedures. They just got pushed out of the way by doctors who didn't want to do them anymore because they either went to IVF procedures or they just don't want to do them within their practice. Probably the biggest one is ovarian wedge resection, selective hysterosalpingogram, and KTP laser for endometriosis. We are doing more advanced laparoscopic cases and more advanced microsurgical cases. When we first started doing ovarian wedge resections, we did 5 procedures. We had 5 pregnancies and 4 patients. One of them got pregnant twice. So it was something where these people had, one person had suffered infertility with polycystic ovarian disease for well over 5 years. And no doctors could help her. She couldn't be helped by the IVF doctors. She failed all of the other treatments. We did the wedge resection procedure on her. She was pregnant within 3 months. And she's the one who became pregnant twice. Actually, there's 4 patients. 4 patients. Yeah, but if you add in the second pregnancy, right? You know, 5 out of 4 doctors are good at math. This just goes along to the changes in the type of procedures that I was doing. I wasn't doing as many laparoscopies before for either chronic pelvic pain or for other reasons, and the number of laparoscopies that we did, either for the diagnosis and evaluation of pain or infertility, increased. Selective hysterosalpingogram was a procedure that I had to go and learn. Nobody in my area could do it, and nobody does do it, but it's a very valuable tool, I think, in the evaluation of infertility. And then we did more hysteroscopies and other conservative type of procedures. We also increased the use of gynecologic ultrasound for treatment of ovulatory dysfunctions. So this changed the revenue source that we were going through. We did see some change in our obstetric deliveries. They went down briefly, but I can tell you right now, I could give some deliveries away. I'm getting kind of tired of being up all night. The deliveries have, if we look at this number now, I'd say we'd be back to the 2002 to 2005 range and beyond with the number of successful pregnancies. This week we had 4 successful pregnancies in long-term infertility patients. And there's some from areas that I treat patients that I don't get to find out about all of them. This is one of the ones that I found most interesting when I went and I looked at our practice patterns, and that was HPV-related diseases, or diseases related to a sexually transmitted infection called HPV. And from the time I made the decision, the number of patients that I saw for HPV-related diseases went down, and you can see that the number of LEAP cone procedures that I was doing went down. We did have a spike in 2007 in the number of colposcopies that we did, but we did fewer destructive cervical procedures at that time. The future, this was back then, but I would say that it is still there. We are in desperate need of expanding our practitioner program. We're actually writing for grants to train at least 10 more practitioners here in the Diocese of Columbus, down in Ohio, and in other areas if we can. We want to continue to educate and train ourselves in the areas of human reproduction and what I call functional medicine. Most doctors want to look at one system as the cause of the problem and ignore the interactions of all the other systems, the adrenal gland, the thyroid gland, the hypothalamus, pituitary, everything else that's involved. So we have to look at it more from a holistic functional perspective than before. Doing more research, either through the Pope Paul VI Institute or just through our own research. We're actually getting a research coordinator hopefully here pretty soon. And explore the process of robotic NAPRO technology. Some people are already taking this on, where we can perform more of these procedures with more advanced cases and hopefully have more outcomes. That's supposed to be a picture of my wife, but it didn't work in Rome and it didn't work now. So, I want to thank you for your time. Making this change to me has brought me more blessings than I could ever imagine. Coming to conferences like this is like coming home for me. It's like a spiritual retreat, because I get to meet so many people who think the same way I do, rather than being back home and working with a bunch of doctors who think that much of what I do may be malarkey, but we don't share the same beliefs. I had to argue for an hour at our Methodist hospital about an early pregnancy termination, and people looked at me like I had 6 heads as to why I would sit there and defend the innocent life that was there. So it's always good to come to these conferences, and I hope that everybody else can receive the same spiritual graces that I get from coming to this meeting. And I hope that what I've been able to say today has been helpful to somebody who may be considering making changes, or may be helpful to a medical student who's thinking about opening up a practice, or it's something that somebody can take back to them. Thank you very much.